To you.
Hi, thank you, Martha. My name is Jillian Stuckey, and I'm the Medi-Cal County lead for our region. Thank you.
And then Victor Valley, Rachel.
Hi, Rachel Storch, Child Welfare and Attendance Coordinator for the Victor Valley Union High School District. And then my director, Tiffany Hampton, is away at a conference, so I'm joining for her.
Yeah, thank you. And Gabriella on Miss D.
Good afternoon, Gabriela Iseca with the Ontario Montclair School District, and I'm here with Paola.
Good afternoon, everybody. Happy New Year's. My name is Paola Veloya Pascuso, and I'm with Ontario Montclair School District. I'm not sure who's left.
I think you were the last one, Paula. Thank you very much, everyone. Just want to make sure everyone knows who's in the room, and certainly want to welcome you. Farah is still stuck in the meeting. She texted me and said she was going to be running late, so I was gonna ask her to welcome everybody, but I'll do that on her behalf. Just certainly want to first say Happy New Year 2025 to everyone, and I hope you had a safe and enjoyable holiday season. Certainly back to the work. Appreciate our schools being here because I know some of them might have just started this week. So certainly appreciate you guys being here, and all you guys, appreciate everyone being here. And so we certainly want to use this time to really orient and bring everyone up to speed on where we are in the capacity grant, because one of the pieces of the capacity grant that we wrote in for our plan is that we would develop this guide that we've been discussing. Jermaine, go to the next slide for me real quick. So again, we've been discussing for the last almost a year now about this resource guide that we would develop for our county for LEAs who decide they want to get into the work of delivering behavioral mental health services to students, and they don't know where to start. Our guide is going to help them do that. So from service delivery all the way to sustainable funding, right? And building partnerships. And so this space is going to, you guys are our thought partners in developing that. So I appreciate our managed care plans being here because they're going to be a huge partner in the sustainability aspect of it. I appreciate we need DVH involved because DVH holds many of our SAP and SAP, well, all of the SAP and SAP contracts, and our districts being able to access those services are huge in what the work being done with our kids. And so, and then of course our LEAs. So again, our intention here is to get perspective from all of those players to really develop a resource guide that a alien comes from Mars and they want to start a program. Our resource guide should help them do that, right? And so we want to go from 0 to 100 in this guide. And so what we will be doing in this session or this meeting today is really giving you all context of where we are as a county in our capacity grant, and so that we are seeing where our districts are and where they're ready to go. So our resource guide to help us guide them in that way. I'm going to be tapping on Rebecca on one of the slides where the state has changed some of the requirements for engaging in the capacity in the fee schedule, new pathway. So Rebecca, I didn't get to hit you up, but how you talk to everyone about that, and then we got some questions about it. I'm sure you'll be able to answer some of those things. But really, how we our resource guide. These are some examples of some of the things that we want to make sure we have in place. And again, we're not asking for any of this to happen today. Really, today's session probably might just be an hour where we're actually just orienting you guys to the context of where we have been in the capacity grant, so you have a better understanding of where we are as a county, our LEAs are as a county in this work, okay? Jameen, go to the next slide, please. So I want to make sure that we are on the same page, and we know what we're talking about when we're talking. Again, you guys have seen this slide, and understanding that the capacity grant is the money that was allocated to each of the 58 counties for LEAs to build the muscle or the capacity to one day utilize the multi-payer fee schedule, right? And so in San Bernardino County, we have 59 districts who are participating in the capacity grant. Those 59 districts all are putting plans in place to of how they will use the money to build towards one day utilizing the multi-payer fee schedule. Okay, so the multi-payer fee schedule is a new funding source that the state is going to be utilizing, where we will be reimbursing, being able to send claims to our managed care plans and commercial insurance. And so our capacity grant LEAs are building their skill set, their structures, their systems to be able to do that. Okay, so again, that's just so we're all on the same page. Any questions on that at this point? Are we all up to date on that? Okay. So Jameen, go to the next slide. So for folks who have not been in the conversations, I know Victor Valley and OMSD Rialto, you guys all know this stuff. Brittany, you guys know, but the state has extended the capacity grant to 27. Okay, so when I'm talking about this guide, this is something that we want to have done by 27, right? So this process is going to take some time. We also want to begin to start considering how wellness coaches and can be built into our countywide system and guide. So the wellness coach have a scholarship cycle 2 that is available for LEAs who want to do this. And Mara, is it? And I know Karen's not here. Is it just LEAs or is it community-based organizations as well?
I believe it's LEAs and higher institutions.
Okay.
So colleges.
Yes. So again, this is the associate and bachelor's level kind of preventative services that the state is seeing as a means for services for students, right? So this is kind of supporting with the workforce. So that workforce too should be a part of what we're going to be looking at in our guide. And then the LEA implementation plans, another part of the capacity grant, this is going to be, they're going to be due on January 31st. And what we will be doing from the County Office of Education, we will be compiling all of that information and sharing it with you all in our March meeting to show you where our LEAs are spending their energy around this work of building the systems around the mental and behavioral health of their students. Okay, so we meet again in March. We'll bring that information after the 31st of compiling and showing where the energy is, so that we can begin to identify the appropriate professional development skills and information that we want to make sure these districts have as we are building going forward. So for example, if folks are looking at spending their energy on becoming Medi-Cal enrolled, right? We want to, as a group, I want to bring that information to you all, and we want to use all of the folks in the room to start talking about what it is that we need to be, we want to make sure our districts know the information, the people, all those things that they would know to make the Medi-Cal enrolled. And I know that's kind of the state piece, but also getting families enrolled in Medi-Cal. So that's another portion that we want to make sure that we are looking at. So how do I hook Rialto up, for example? How does Rialto get hooked up with IHP, with Molina and Kaiser, to make sure that we have a system to identify kids who are not covered, and we get those folks covered? Many times those things are really built upon relationships rather than some kind of system that's put in place. And so we want to use this space to develop those kind of systems. That's why we are excited that we have everyone in the room. If people are trying to build around around their MTSS around mental and behavioral health, how do they utilize the tier 3 services that DBH contracts provide rather than trying to use DBH as their tier 1 for all therapy, right? So we want to utilize this space to develop what we want LEAs to know. Any thoughts, questions, or concerns about that? I hope you guys aren't gonna make me talk and y'all just look at me. Is it making sense? Is this making sense, or the direction that we want to go? Dr. Howell, you got a smile on your face. Rachel, go ahead.
It's making sense.
So Rachel, as a school district, when you think of like building structures and systems around anything, but around this work, mental and behavioral health, would you agree that districts are going to be in need of like some guidance and some how to in this work?
Yes, I would agree with that. We've heard a lot from our sites and our own mental health clinicians that to support that, they would need like some drug specific counseling, right?
Mm-hmm.
And so that's nothing we have a structure for,
Mm-hmm.
right? So, thoughts are being around, like, how do we improve that? And I liked how you said, like, you're going to gather everything we said in our plans and then all come together. Like, if you want to improve the infrastructure on how to build for Medi-Cal, but yet we're not encouraging people to have Medi-Cal, like, the parts of it. So I think coming together once we submit our plans would really be helpful of just, oh, I didn't think about that, but that's a good part of your plan. Maybe I should add that into my plan,
Right.
So I'd be, the March meeting would be pretty exciting to hear what people have and then how we could think of those different steps to help us.
Yes, no, thank you. And I've always pick on you, Dr. Howell, because I be liking your brain, but you were smiling about something.
James, I'm smiling because we've been working on this for longer than a year.
Uh-huh.
And what you just did is basically present everything in a very nice, cohesive manner of all the little pieces that came up 13 months ago, 14 months ago, and that's why I was smiling, because you're saying it very well and it's on point and all of that, and it's just I was a little impressed that we got 59 school districts. You said? Yes, sir. Right. So I'm assuming that's more than CYBHI school linked or school based fee schedule uses that term school district different than I've ever heard it before. Mm-hmm. So they're including charter schools.
Yeah. So really, right? I should have said LEAs, right? LEAs.
Right. Yeah. Well, no, they use district. You're using it right. But so I was smiling because you're doing a great job, and you pulled this all together after 13 months. So just nice to see it pulled together.
Oh, good. And totally, that's exactly just from our conversations and meetings and SB HIP. So again, I think the biggest thing for me is that we don't take for granted what the work has already been done. So a lot of relationships and things built through our SB HIP. That was my baptism to this work, and us moving from utilizing SB HIP to really drive where our county goes in this work is going to be essential. And so certainly thank you for that that confidence, Dr. Howell, because I know if I got it right with you, I'm good. I really know I'm good. So, but that's really what we want to be utilizing space. The other piece is, again, we are going to use you all as our thought partners in what information we have to hold office out. We not office hour, but community of practice opportunities for these 59 LEAs in the capacity grant. And so we want whatever we feel in this group needs to be addressed or put across, be taught to our 59 LEAs. We want to use you all to help speak to that, right? This group here. So Jermaine, go to the next slide. So again, kind of, and these slides will be shared with you all. This is kind of just for information for folks who are not necessarily always into the fee schedule and all that stuff. This is just some of the updates. The biggest update here is that the cohort 4 application has gone out, it's been released. And on our next slide, I can kind of show you guys who's in 1, 2, and 3. But so far, the last bullet kind of talks about who has actually sent the first claim. And so this has been a long time coming. Again, Rialto and Redlands are in cohort 1. And Cecilia, when was cohort 1 supposed to be sending sending claims? You remember what was the date? Or Rebecca, anyone you guys remember that?
I'm not sure. It got moved several times, but yeah, we haven't sent any claims yet because we're still waiting for our DUA. We have our PPA and all that. And I know they invoiced for December. I'm not sure if our district's invoiced for January yet.
Yeah, no, I know. So yeah, Rialto is still doing some dealing with some logistics with the state. But I just wanted to lift up that the state, and Rebecca, you're going to say the state, whole statewide, we haven't been able to do it. Cohort 1. When were they supposed to? Rebecca, if you recall.
They changed it to July of 2024 and then December. And to be quite honest, I've been out for a few weeks. So now I need you to update me.
Yeah. Well, so they are beginning to start sending claims, but they were supposed to do it a whole year and a half ago. That's really what I wanted to point out.
Cohort 1 started January 2024, and we assumed they'd be able to start right away. And then it was like, oh, they can't. Then July, oh, they can't. And so on and so on. So, but I know it's happening now, finally.
Yes. And so we have, next slide, Jermaine, because I want you guys to see who in our county is in position to start doing. So these are a list of the what do you say, about 15 LEAs who are participating in the fee schedule in the cohorts. Okay. Again, the state is very far behind in this, right? In the implementation of these cohorts, because again, as we said, cohort 1 has been going on a year and a half, and they are just beginning to send claims. Cohort 2 and cohort 3 just finished, but cohort 2 is beginning to do some of the paperwork, which again, Rialto just talked about. Some of the language in the data usage agreement is not school friendly, right? It's not necessarily school friendly. So this is why it's so important in our county that we involve all our players in the conversation, because there's a lack of translation amongst us, right? Different conversation, different language, different things that we have to consider. And the state is trying to bring all this together. As we're learning from the state, it's important that our county kind of watches that and we don't make those same mistakes as we're trying to implement this, right? So as we are looking at what would schools have to, what language will schools need to partner with the managed care plans to do certain things? Like, we need to already be in front of that. And SB HIP has helped us a lot with that. But that's got to be things that we in our county, we don't make mistakes to learn from. We actually let the state make their mistakes, and then our county learns from that. So of these LEAs, these are the ones who are participating in the actual fee schedule in the cohorts. Cohort 4 has the application been released, but these are the ones who have been accepted. And is there any questions before because I know I keep just talking a bunch of, is there any questions or wonderings about this process or participants? Nothing. So now, again, how does this fare for us in this group? What does this mean in the context of this group? Really, as we continue to support these LEAs in this effort, us taking note to the ins and outs of this implementation so that we can bring this back to you all and added to the guidance that we want to deliver, right? So again, what a big portion of it is going to be the EHR system, right? An EHR, so electronic health record. And I think part of our big conversation around the electronic health record was us trying to develop or buy something, or because we from the county office is going to purchase something that schools are able to utilize to get themselves going. And we were trying to really consider looking into one, what's Farrah always say, one EHR, one child, one EHR, something like that. And I think some of the conversation that we learned from our medical folks is like, that ain't really how it works, right? And Veronica from our team too, says, that HIPAA, FERPA, all those things is we gotta consider. Again, school folks don't always look at that kind of thing, right? So we're not, we don't kind of know the ins and outs of that. So these folks have to be in position. They must have an EHR. They have to be Medi-Cal. Well, 1 and 2 needed to be Medi-Cal enrolled. That's not a rule anymore, and we'll talk more about that. But we just understanding the context and the needs of these folks to participate in cohort 1, 2, and 3, and what we have to teach them to learn, what we want to learn from them. Go to the next slide, Jameen.
James, could I comment really quick on the last
Yes, you
slide? This is
can.
Rebecca.
Mhm.
It's interesting to me that only 15 of our districts out of the 59 getting the capacity grant are in cohorts 1, 2, and 3, with obviously 2 and 3 having more than 1. But it's also interesting that some are just completely new. Some don't do neither LEA, BUP, or ESMA. So that's promising to me that they want help and they need help and they have a need to be involved. And so I just think, again, from your team and mine, collaborating and helping those districts, and some of them are quite small. And then there are a couple that are completely brand new with me, already eager to be a part of this. So I like seeing those statistics and seeing who's doing what. But then I also am concerned of districts that I feel should be in cohorts and they're not. So maybe they are all waiting for cohort 4 and even just the open-ended period of not needing to really apply like these previous cohorts had to. So thank you for sharing that slide with all the districts listed.
And OMSD, Gabriella, you guys are in cohort 2, right?
Yes.
What position, what point in the process would you say you guys are? Where are you guys at in the process?
We just had last week, we have most things in place. Last week we had the first onboarding with Carolyn.
Mm-hmm.
And we already, from our capacity grant, we already hired the biller and some clerical support.
Right.
So,
Okay.
and I know some of the schools from the district are getting support on getting the individuals qualified as wellness coaches
Mm-hmm.
so that they're ready.
And so with did you guys for cohort 2, all of the PPA, the DUA, you guys were all good with it? You guys are moving forward, Gabrielle?
Yes.
Oh, good. Okay. No, thank you. So again, what are they saying you guys could claim, Gabrielle? Like, what is the conversation around that? Send claims.
Oh, well, it was the first onboarding, so it was like
Oh, okay.
all kind of thing. We haven't deep dived into because that will be one of the things that we need to do, because we do have contracts with DVH and we do the LEA and MA. So want to create a scaffold and see which providers are going to be billing what and to what program, so that we make sure that we're not duplicating anything, but also that we are not leaving anything on the table.
Right.
Yeah.
So okay. So any other questions? Any other questions? Okay. So go to the next slide. So the COE, so again, the implementation plan, we had an implementation plan as a county office. Each of the LEAs are going to do one, but we have to do one we have to develop one and establish one for the state that we share with the state. So this is just some of the highlights of ours that I wanted to bring to the network, just so we are all on the same page and looking and how we want to address this in this process. So again, as I was saying, many of our districts are not in position to develop, like move in a robust way around this mental behavioral health in a way that they would be able to leverage the fee schedule. So as Rebecca was saying, we have 15 districts involved. Pretty much we have 15 districts out of our 91. We have 59 participating in the capacity grant, but we have 91 LEAs in our whole county. Many of them do not have capacity to deliver mental and behavioral health services in a way that they would be able to be reimbursed by commercial or managed care plans. Okay, one of the big issues that we're finding is they don't have electronic health record. They're going to need one to reimburse. They don't have that. So what we wrote in our implementation plan is that we would use some of our county, the funds allotted to the county, to purchase an electronic health record that would that districts who don't, or LEAs who do not currently have one, could utilize, so they can begin to work in the system. So we are going to begin to solicit LEAs to volunteer to participate in the EHR selection committee. Okay, so we didn't want to develop a buy EHR from our office and then say this is what y'all get, right? Because we don't provide services. So we want to involve some of our partners in the capacity grant to help us do that. We brought this up to you all because if this is something that you're interested to help us with, we want you to be a part of it. Not something that we are asking the network to require network to be a part of, but if people are interested in helping us with the vetting of this EHR that would be purchased and provided to participating LEAs, we want you to be a part of that. We will be going through a request for proposal process with our county office to do that. But we want this to be a very collaborative effort around the EHR. Certainly want to meet the needs of our LEAs, which will ultimately meet the needs of our families. Okay, so that's another portion. And again, the EHR process would be something that we would be documenting in our guidance, okay, in this guidance tool that we're talking about. So again, everything that we're describing and everything that we're doing in the capacity grant space, we want to leverage ultimately for our tool that we want to build, our countywide tool. Okay, so everything is we're trying to be strategic about everything. Thoughts around an electronic health record being purchased and utilized by our partnering LEAs in the capacity grant. Any thoughts? Any tomatoes? Any like y'all crazy? Anything? No? Still down the right road, y'all? Y'all quiet. Y'all tell group. This thing on? Okay. So go to the next slide, Jameen. Other piece that we want to bring, and this is something that our other partners, oh yeah, I'll go back to Rebecca on that pathway, right? But so we internally at the office, we've been hearing what the state is saying in the state's direction around insurance authorization, HIPAA, FERPA, stigma, right? There's been a lot of conversation around these things. We want to make sure that we compile all of different resources. Maybe the Department of Behavioral Health has some resources around stigma that we could begin to compile, right? Insurance authorization, Kaiser, Molina, IHP, you guys might have some things. How can our LEAs a process for student establishing student health insurance information? These are things that we want to begin to compile resources for. So, for instance, OMSD, Gabriella, when you guys are getting student health insurance, how are families responding to getting their health insurance information, giving their health insurance information to you all?
Well, right now with the system that we've had, it's on a one-on-one basis, so we have an opportunity to explain to them. But what I wanted to bring out, I don't know if you're aware, but through the CYVHI initiative, they had a state committee that was working on sample forms. That was a big concern about how are you gonna, explain these to the families. So I was part of some of those committees, and it was literally to the wording to put on forms. So they're coming up with samples that they're supposed to distribute statewide in terms of these are materials that you might want to use tailored to your needs, or if you already have your stuff, good luck with that.
Yeah.
They're putting out a lot of statewide guidance. I don't think it has been released yet. We haven't gotten it, but they had a pretty robust group throughout. We know from people from all over California that are currently providing mental health services, and they were working on how to explain it to the parents, how to explain it to the kids, and and how to collect the information, like what the purpose of collecting the information and all that stuff.
Yes, I was on one of the committees that I can't remember what Kenna's last name is. Rebecca, what's Kenna's last name from DHCS?
Cook.
I think it's Cook, yeah.
Cook, yeah, Kenna Cook was leading around the marketing resources and tools for districts to utilize to inform parents about this totally, right? So I was on that committee. So I know the state is beginning to develop some things. I know the meetings start getting denied. One of the things we have done is we being our county office and the folks on my team is as we've been hearing these conversations and really pulling from some of their resources. To me, I think it's very important that we establish some of the tools and resources that are in-house. And when I say in-house, I'm talking county, right? So what are some things I know in our and I keep going back to SB HIP, but that was kind of where we started to practice this, right? Like a lot of our we had a flow chart of how I remember JR built a flow chart for LEAs of how Medi-Cal works. Amri, do you remember what I'm talking about? Like those kind of resources are things we need to pull from. So when we're thinking about gaining student health insurance, is there things that Kaiser, things that IHP and Molina have in place or that they've developed that we might want to start compiling? That's what I'm bringing in here. Kaiser, IHP, Molina, any thoughts on products or resources, tools that we could be pulling from right now to start compiling? Amrita?
Yeah, hi James. So related, and I think this is related to the conversation you said earlier, how do we identify those of our kids who are not insured? I mean, everyone needs to be insured, right? So I actually, this is kind of an opportunistic time. I met with somebody here from our enrollment and eligibility department. So we have enrollment specialists. I don't know if Kaiser and Molina have enrollment specialists, but so we are working with the community colleges currently, the chancellor's office. And so what they're doing is when they're gathering information from their students, they're asking if you are uninsured, and I can, you know, I can get you the language, but if
Mhm.
you're uninsured, do you give consent for an IHP enrollment specialist to give you a call? Now, I'm learning from our side because that's not my area. My response back to that person was, well, why would a school district only want an IHP person to call the member? That's kind of not working with the insurance agnostic kind of concept. But as Molina and Kaiser know, just because an IHP enrollment specialist contacts the person doesn't mean they'll enroll them in IHP. What the enrollment specialist does is walks them through the application, and then the application goes to the county. And then the member gets or the prospective member gets a call or a text to have an appointment and an interview. And then at the interview with the county, not IHP, they get to go through and eventually select if they want to be with, Kaiser, Molina, IHP, whoever it is.
Mhm.
But this is a way that we are offering a support to just get people on Medi-Cal. It doesn't matter what managed care plan, but just to help them with the process. And I can tell you, a couple of weeks ago, I actually had to do this because my grandmother, who unfortunately passed away 2 weeks ago, I had to
Sorry
get
to hear
her on Medi-Cal, and I'd never been through this process. So I reached out to my enrollment team, and they actually did everything they would with a member or a prospective member. So she actually walked me through the site online. I filled out the stuff, and when you're in, I work in this field, but I was a member at that moment, right? And so I lost all my skills because it was an urgency. And this enrollment specialist walked me through, and then I got a text from the county, DPSS, saying, "Hey, we got your application. This is your appointment. We will call you or call us." And so IHP was out of the picture at that point. So, I don't know if this is something, I was actually going to bring it up to you, James, but this seems like it worked well on this call. This is a way potentially that we can kind of fast track and support uninsured to just get on Medi-Cal.
Yeah. And that really would, honestly, one of the things we always look at, the capacity grant has 4 parts to it, right? Medi-Cal enrollment, billing infrastructure, data collection, and service delivery. And when I heard Medi-Cal enrollment, they're talking about the LEAs being enrolled in the Medi-Cal programs. But I think we also have to, in our county, we need to be looking at Medi-Cal enrollment for our families, right? Right. How do we help our districts, our LEAs, support their community in being covered? Because if we have people covered, then we can also, as we're looking at the fee schedule, we cover people, then we can also reimburse for the services that families are receiving, right? And so maybe us looking at our first steps of really, yes, sir, Dr. Hagen, our first steps really being how do we get our families access to services, which is being covered, right? So maybe this might be a start of where we might want to start in March of getting our people covered. Go ahead, Gabriella.
So we have a process internal as a district that we've had for many years now, where we have 2 insurance enrollment specialists, and we have district-wide insurance enrollment campaigns that happen 3 times during the year. The first time is with the enrollment packet. Then we do one mid-year, and then we do another one at the end of the year with insurance, we send paper forms, we QR codes. So there is a whole process. And then if families are not covered, our insurance enrollment specialist internal through the district will reach out to the families and kind of go through the process like Amrita was, in fact, there was a point back in the day, more than 10 years ago, that we used to partner with IHP, and actually the state also was part of that. They were funding the insurance campaign, and Molina was part of it, where we will collect all of the surveys, and because we had so many people uninsured at that point, they will help us make the phone call. So it was us, and the 2 health plans that we had at that time.
Yeah.
With the change in legislation and people, immigrant children being able to be covered and things like that. But they also insure on Cover California and help them enroll in welfare, CalFresh. And they're here year round. So whenever they have, like, they get a letter, like, you need to submit this document or things that they don't understand, they reach out to the insurance enrollment specialist and they will help them so that they don't lose their Medi-Cal.
Right.
It's very helpful. And I don't know.
Yeah.
I don't know if, I think we might have a flow chart or something that, if it will be helpful to
use.
other districts, we can share that in terms of what.
Absolutely. No,
Well-
and that's what I'm talking about. Yes, Gabrielle, go ahead.
Because enrolling them is great, but keeping the enrollment, that's the month-to-month challenge.
Yeah.
Because we have so many kids that lose their Medi-Cal at month-to-month because they didn't submit a form. Because see what I mean?
Yes.
So it's a lot of constant education and helping the families and re-enrolling them as soon as possible so that we can continue to provide services. So yeah, there is a process that if you guys are interested, I can talk to my team and see what we have to share.
Yes, please. Because ultimately, and I would love for Melina and Kaiser, if you guys have any thoughts, our small, especially our charters. I mean, we've been working with them during this capacity grant, and they don't have a lot of bandwidth, right? They don't have a lot of capacity. Like, if we can identify best practices, then we can expedite some of the implementation of these things and make sure kids are getting access. So, Gabrielle, exactly what you're talking about. And we know OMSD for our county is one of the more sophisticated systems that we have, right, in our county. And so how do we pull those best practices and start to share them with our smaller, more, beginning leveled or novice districts around this work? So absolutely, anything that you guys have, we would love to have. Kaiser, Melina, any thoughts on getting folks enrolled? Any resources and tools that you guys have developed that we could utilize?
Hi, this is from Kaiser Permanente. So we we also have a phone number to call specifically for our Medicaid members. And that is available 8 a.m. to 5 p.m. And it is the same helpline that's for re-enrollment. Again, like we were just saying before, it's a lot of the same. So I think it would be important to keep those resources together. Also, when you're talking more generally about services, I'm thinking mental health services for youth. I'm thinking, community health worker benefits and all those, non-medical transportation. If there is an email, I have some resources on hand, and I would be happy to kind of, you talk about the workload. I'd be happy for us to kind of take on the KP workload of gathering all of our resources, and I'm happy to send it to an email or upload it to any sort of drive that you may compile.
Okay. Yeah, with Mara, if you will, put the SLP email in to the chat. Jill, that would be great. And again, because we have all of the folks in this conversation, and Lisa, I know you're driving. If you have anything, I want you to speak. But if we have, do we want to develop for our county, develop something that really speaks to all 3 of our managed care plans, right? Like, when we're talking about something that we can give to our LEAs about enrollment, right? So we know, like Amrita was saying, that IHP has these enrollment therapists, or not therapists, but enrollment folks that would help with all managed care plans, right? But if I didn't get a hold of that individual, how do I make sure that I got the, what you call agnostic, or something you said, insurance agnostic, some word you use. Go ahead, Amrita.
Thanks, James. And Jillian, I don't think you were part of this email because I know you just came on board, but Lisa from Molina, a while ago, I kind of floated an idea by Kaiser and Molina, letting you all know that IHP was moving forward in piloting kind of e-toolkit, if you will, and we're actually piloting it with one district in San Bernardino and one in Riverside. And what that is basically providing to that district a it's still in the building phase, so it's probably not going to go live until end of January. So I'm trying to, I haven't really seen the finished product, but essentially the concept is a kind of a landing page that links directly to our information. So, you know, of course, this is only for families who have children with IHP, but essentially it would be at on their parent portal or something like that, saying if your child or your family belongs to IHP and you have questions about rental assistance, or you want to know, you know, what resources you have, click here. And so it kind of is like a one-stop right there. The school is trusted. They go there. They understand their school is partnering with IHP, and it takes them directly to a benefit that honestly is a Medi-Cal benefit. So it's not specific to IHP. It's also Kaiser. It's also Molina. But so Lisa, I don't remember. I don't know if you remember me floating that idea. And Jillian, I floated that idea by Alex.
So, and Amrita, I do. I actually have talked with our leadership and just exploring how Molina can, you know, do, you know, something, you know, very similar and kind of piggyback on that, because I mean, ultimately being able to have that quick access, that direct access to one's health plan is key, because there are a lot of benefits that people do not necessarily connect in their mind to their insurance, and being able to have that quick click, that quick reference, I think would help kind of bridge that gap, and, you know, definitely make it easier for those that are, you know, seeking the assistance.
Right. And I think, at least to go with that, people don't know. Again, before I got into this position, I didn't even know what a managed care plan was. So what I say that from, I was a leader of a school site, right? Mm-hmm. And so how can we leverage schools? You know, if we can educate our educators and our educational system around these things, then we can leverage that to really provide the access to our families, right? So when we're looking at our CYBHI, we're looking at community schools efforts, like us really leveraging our relationships with our managed care plans, our partners, our DVH, all these folks, to actually not ask schools to be the ones to know everything, to do everything, but to actually know where to access everything, right? Because schools have the kids and the families. You guys are looking for the kids and the families. You guys are looking for your partner. We're looking to cover people. Like, how do we leverage? So we have to engage our school folks, our LEAs, the Jameses of the world, the principals and the directors and superintendents who have no idea what you guys are talking about, right? But we have the families and we have the need. And so if we can do a great job of coordinating ourselves as a county, that will change the trajectory of our students and their families. And that's really what we want to build here, just that level of coordination. So I appreciate you guys in that. What I wanted Rebecca to speak to, because I know I start talking in time. Rebecca, I wanted you to speak to how we have moved from, the state has moved from the path of I guess they moved to a path of least resistance, where they don't have to they don't have to be in the LEA bot program anymore to participate in the fee schedule.
Yeah, of course. So we're very grateful and thrilled that DHCS did create a new pathway for school districts to be able to join a cohort through the fee schedule with CYBHI and be Medi-Cal enrolled essentially for the cohort program only, which if you were in LEA BOP, you were automatically Medi-Cal enrolled and you could do LEA BOP and CYBHI. And if you do the Medi-Cal enrollment through CYBHI only, you cannot participate in LEA BOP. So it's not interchangeable. If you're going down the Medi-Cal enrollment pathway through CYBHI, you still would have to enroll through LEA BOP as well. So that's the only like hiccup, if you will, if a district thinks, oh, I'm Medi-Cal enrolled because I participate in a cohort and I could do LEA BOP now, that is unfortunately not the case. But if they are in LEA BOP, they can obviously be in a cohort. The issue we were having is a lot of our small charters or very tiny districts wanted to be in a cohort, and we actually had a few join cohort 3 that were not LEA BOP enrolled, which meant they weren't Medi-Cal enrolled. And we had been, when I say we, the LEC, which is what my team is referred to, there's 11 of us in California who run the SMAW program, RMTS, and oversee the LEA billing option program. We had been pressuring DHCS to figure something out because it was holding districts back from being able to participate in a cohort. And when I personally saw some of our districts in cohort 3 that were not enrolled in LEA BOP, I panicked. I was with Veronica and Mara and James's entire team, like, what are they doing? Why did DHCS allow this? Well, they had already knew DHCS that they were going to be able to implement their Medi-Cal enrollment through CYBHI as of cohort 3. And so they were basically grandfathered into being Medi-Cal enrolled, which was a huge relief because joining LEA BOP, though it's a beneficial program, we want everyone to do it at some point. It's not easy to get enrolled in. It takes about 6 months. There's a lot to do. And going back to that EHR, if you do not have a vendor, you have to do everything yourself internally, which is a lot of work. So some of our districts were panicked that they couldn't be in LEA BOP and then they couldn't be in a cohort, which, long story long, is not the case anymore, which I'm very happy to hear. But James and I have talked about this a lot over the last year. And we ultimately want them in every program. It's not just SMAW and LEA BOP now, it's the fee structure for CYBHI. So each program ultimately could pay the district back in reimbursement for almost anything on the table. And we want, if one program doesn't pay you for this, we are hoping and wanting the next program to fill in that gap. So we're not discouraging districts from not doing all 3. We want districts to do all 3 of them, but I do think it's a lot. One of my districts specifically, that's on that cohort 3, just joined SMAW, just joined LEA BOP, and now they're in CYBHI cohort 3, and I feel for them. And I know it's not easy, and there's some discouragement. So if we could all rally around them and do what we're here to do and help them get through it, that's my goal. And I know that's probably everyone's goal here on this call too. And even just sharing your expertise if you're a school district, especially one on the call who doesn't have a vendor and you guys do everything internally. I recently recommended a district talk to you guys, so I'm grateful for the connections and the relationships we have. But ultimately, if you want to be in CYBHI in a cohort, you can, because you're Medi-Cal enrolled through them. And I'm grateful for that because now I don't have to panic.
No.
Any questions?
Yeah, and right, you
Go
said
ahead,
you were
James.
panicked. No, many of the districts, and Rebecca's right, many districts and LEAs, I keep saying districts, many of the LEAs were reaching out to quickly get enrolled into the Medi-Cal program to participate in the fee schedule. So the state making that change is huge, right? But ultimately, again, when we're thinking about what's best for San Bernardino County and the schools within San Bernardino County for sustainability, all being a part of all Medi-Cal programs, utilizing our DVH contracts appropriately are going to be key to the access and service delivery of our to our students and our families, right? And so again, as we're looking at this guide, we know there's a pathway that can get you right to the fee schedule. You can get some kind of reimbursement, but we want to make sure that we have all 3 or 4 pathways that go for districts to learn how to get all of the funding mechanisms available to their families, right? And so that's a major portion of our guide. And so I wanted to bring that in. Thank you, Rebecca. I wanted to have Rebecca speak to that because that's a major change in the way that we even will approach our guide because there's a different pathway. Any questions for Rebecca around that? Thoughts? Anybody?
I just want to add that I'm grateful there is this new pathway because I am hopeful that any small district or charter that can't on board for LEA BOP can on board now for a cohort, and they'll see that reimbursement and then they'll want more and they'll eventually come to me to join the other two programs. But not to put pressure on you guys, I know it was very quiet when James said they need a EHR like subcommittee to help vet vendors, but they're chomping on the bit for you guys to do that because I think that's going to be the golden key to helping them know that they have your support and that ability to use a EHR, that you guys are vetting everyone and they don't really have to do the legwork because they just aren't able to do that. So I think the pathway was step 1 and the EHR will be step 2. And I think they're going to be really pleased when everything's said and done.
Yeah, no, thank you. That's great. Thank you, Rebecca. Next slide, Jameen, please. So another thing that I wanted to bring, and again, this is something that we want to make sure that we are coordinating and bringing into our guidance, that our students have access to 2 state-sponsored services or apps, and these are just the apps. Again, this will be sent out to you all. And I know when we were in, and we're still in SB here, but Melina, Lisa, you guys had a very similar app to this as well, didn't you guys?
Yeah, so it was called Be Me.
Yeah. Was it for students or was it for students or was it for the teachers?
That was for the students. I think for the teachers, you were thinking about the Psych Hub, which is still available.
Okay. Yeah. And so I want to make sure that we are pulling all of those resources. So thank you, Lisa, for that. And that was available to Lisa, the Psych Hub, and the Be Me was available to Melina. Was it only Melina?
No, Be Me was extended to all students, and that was IEHP supported as well.
Okay, so those are, again, different resources that we have in our county. Again, I don't necessarily think that we are always resource poor. More, I think one thing that we have issues with in our county is implementation and practice of the resources, right? And so us helping the districts to coordinate how to do this would be a major piece to that guidance, right? So how can we leverage a Be Me, a Bright Life, a Saluna, so that kids can get the support they may need at the tier 1 level, and then we know that kids have that, and then we build our structures and our systems around that tier 1 that is provided. So this is a free service that is accessible to any student 0 to 25 or youth, not just student, youth 0 to 25, free throughout for the state. Okay. Now, again, this is just, again, more context and more information for you all as we are looking to help them build their coordinated system of care, right? They need to build a system of care. They need help building a system of care. We are going to help them build a robust and effective system of care. And we want to make sure that we're pulling all of the different resources and tools to do that. So I wanted to lift up Bright Life, Saluna, and I know our own managed care plans have some things in stake. So we want to make sure that we're encompassing those things as well. Next slide. We're moving. Time is going by fast. So kind of to round it all off and get to the end of our meeting, I wanted to pose just 2 of these questions just from some of the conversation or things that I brought up today. And just without necessarily having the data that we're going to bring you guys to our March meeting, because you see, We have a March 27th community of practice, but we will be meeting before that. This group will be meeting before that, like March 12th or something like that. I don't know what the date is. But just from what you've heard so far, and you think about where LEAs are, what LEAs need to know, what communities need to know, what are some key topics we should focus on in our next community of practice, just from what you guys have heard or what you guys are hearing from the state, be it our managed care plans, be it our LEC, be it our LEAs, just what are some things you guys think would be good topics for us to consider for our community of practice? Anyone willing to start discussing, to answer? Nothing?
James, this is Rebecca. I'm sorry if you could remind me, this is where everyone who's getting the capacity grant funds is joining?
Mm-hmm. So we have our office hours bi-weekly, right? But that's just updates. The
Right.
community of practice would be an opportunity just around capacity building, professional development. It's an opportunity for us to actually provide them with some rather than just updates to the capacity grant.
So they'll already have had submitted their implementation plan, 'cause
Implementation
that's
plans.
due. I'm thinking,
Yeah, the 31st. So that's due January 31st. And that's why I'm saying we would bring that data to our group here around what was the kind of where the implementation plans landed. And that would really help drive the topics, right? That really help drive our topic for our community of practice. But again, just asking you all, as you're looking in your crystal balls and you're seeing what's happening from the school level, the county level, the managed care plan level, just some thoughts. Cecilia?
Yeah, I had a question on our LEA deliverables, that's PowerPoint that we had. It says the progress report 1 is due January 31st, but if we haven't done any claims, what would we be reporting on? Like what, I would like to know, like, how do we figure out what to put on the progress report, like moving forward?
So the progress report, actually, the progress report for the LEAs is not due until July of 25. The COE's version of the progress report is due. So ours is due, Cecilia. Ours is due.
Got it. So
Yeah,
on our end,
ours
we don't have to do
No.
anything? Okay,
No,
good.
not till
We're
July.
forward?
Yeah.
Okay, perfect.
Yes. And thank you for bringing that up. But what LEAs who are participating would need to be doing in the progress report, you all, and that's just to provide more context to the whole group, is whatever work they are doing to begin the capacity grant, that's what they're going to be sharing in their progress report, right? So it wouldn't be anything to do with sending claims, because that might be something that Rialto might be able to speak to, because you guys are a part of you guys are a cohort once you guys get there, right? But that could be a part of your progress report. But really what the progress report is, we've hired, and Gabrielle was kind of saying it, we've hired a billing specialist. We've created a new position. We bought a building, whatever it may be. Those are the things that would happen in the progress report. We would bring that data to you all too, because again, we want to make sure we are seeing the fruits of their labor, right? The things that they're doing, and really seeing where our county is moving around in this work, right? And so that's, again, the crystal ball with the topics. Y'all don't seem like y'all got no topics for me. The other piece, well, we have no topics. Y'all can't answer my second question either, right? Around how the topic can make sure that it aligns to the capacity grant. Again, ultimately, as for example, a topic could be Medi-Cal enrollment, right? Medi-Cal enrollment, and not enrollment as a organization, but families enrolled. That could be a topic, and the alignment of that would really be, again, kids getting access to services, right? Kids or community getting access to services, and then our partners, our LEAs being able to reimburse for those services, right? And so we want to make sure that we are aligning everything in a way that like Dr. Haugen said, we've been discussing for 13 months now, that we begin to coordinate and align everything towards the same, utilize our energy towards the same thing. Okay. And I know it's been a lot of information, so y'all probably like in the class, I'm like, so I'm gonna finish it up, right? So go to the next slide, Jameen. Oh, so what we will send this out, but much of this information, because it's been a lot of conversation, a lot of talking on James's end, but I really wanted to use this space, this opportunity to really just bring you all up to speed on where we are in the capacity grant, so that as we begin to move forward, we utilize the capacity grant as our kind of guinea pig for what we're going to build in our whole county, right? So I wanted to bring you guys up to speed to that. So as we move forward and we begin to look at what capacity do we want to build in our county, we want to use you guys to help build that in our 59. And then that's where we would get to rehearse. We would do the dress rehearsals there. All of this information that we've talked about will be is in the live binder. And we'll send the slides out to you all today. Also, what is new is the scope of services, the fee schedule is updated. So being able to see what can be reimbursed will also be great for, I know some of our LEAs who are already participating know what kind of are involved in this, but DBH, managed care, kind of seeing what our districts are seeing. Like Rachel was talking about the drug classes and drug intervention, right? Making sure that we are considering that. Now, we always are talking about mental health and behavioral health, which is mental health, and we understand drug counseling, all that stuff it goes under behavioral health, but I don't think our schools really consider about how could they bring drug counselors and don't have Mr. Soward, who was the school-based counselor at the high school doing the drug classes. I could do that for maybe somebody who the preventative side, but the way some of our kids are utilizing drugs, they need it more than Mr. Soward, right? And so in the district I was in, we used the counselors to do that. So I was doing those classes, but I wasn't a drug counselor. But if they're seeing drug counseling in the fee schedule, then they could be building systems to make that happen so they can reimburse for some of those services, and they can start to contract with maybe some outside community-based organizations who do that work. So that's an example of what we need to help folks kind of see. So Rachel, that's a good example. As you guys are having this discussion around intervening with the drugs, again, this isn't just kids kind of just got caught smoking some weed on the side of no, these kids are addicts, right? Unfortunately, these kids are using heavy drugs. They need some more intensive support than what schools are usually providing to them. And so that can be seen in the fee schedule and can be reimbursed, and we can make sure we can sustain some of those services. Okay, so in the live binder, you'll be able to see that. You'll be able to see the scope of services sheet in there as well. Any final thoughts, any considerations that we could be looking towards in the next 2 months before we meet again? Anybody? I know you guys have been really quiet.
I did have a question, and I did see it in the chat that we did have a meeting scheduled for March 11th.
Yeah.
And then also again on March 14th, right?
No, it shouldn't be. It shouldn't be two. If there's two on there, Rachel, we got to fix that. We'll fix that. And then
I did see on the slide, I thought it said like March 27, but then I didn't have that.
Yeah.
On there.
So March 27th is actually the community of practice that was sent out to the capacity grant folks.
Okay.
So that's not this meeting. So again, and I had the team put the 27th in there, because even if we find that our topic again might be around managed care plans and getting enrolled into managed care plans, and like maybe us asking our managed care plans to help facilitate some discussion there. So just so you guys know what's coming down the pipe is why we added that March 27th date, Rachel. Okay. Any other thoughts? Jillian, I know this is your first time getting to be here with us. Appreciate you coming. Any thoughts? Anything? No? Okay. And Martha, thank you guys. thank you all the partners. And when I say partners, I'm really talking about you folks who ain't school people come in to the school space, because again, this is not our forte. So we certainly gonna be needing y'all to kind of help guide us into this work. So I'm our managed care plans, man, got Kaiser again, Farah, we got Kaiser, we got Molina, and we got IHB all in the same room. And so for us, this is huge, because it certainly is showing that we are building the relationships that we need to build. So Farah, thank you for that, because again, we've been doing this for 13 weeks. So 13 months. So this Farah's idea was like, man, how do we get everybody in the same room? And this is actually like, we're getting everybody in the same room. So Farah, is there anything you want to say before I end the meeting?
Well, just thanking everybody and reiterating what James has said. And it's really a powerful convening. And it's really it goes to show you how committed and invested all of our partners are, whether the districts, charters, and our managed care and other community-based organizations. So we're really grateful for that.
Yeah, thank you guys. Thank you very much. And again, anything that comes out, we'll make sure to send it to y'all. And any communication or contacts you guys need to make with us, please don't hesitate to hit us up. So thank you guys. Oh, thank you very, very much. Thank you very much.
Thank you, everyone.
Thank you.